Hello guys, now we shall be discussing one of the most important topic which is again and again asked in anatomy as well as in your surgery. It is very important and that is regarding the mammary gland. Okay, so we shall be having a discussion on mammary gland. We shall have a discussion today on mammary gland. Now, before I discuss mammary gland, few important things you need to keep in your mind is that this mammary gland is a modified gland. Okay, it is a modified apocrine gland. So this mammary gland is a modified sweat gland of apocrine activity. All of you know this thing of apocrine activity. And moreover, mammary glands are both present in males as well as females, but in males the mammary glands are rudimentary. Okay, but in some cases in males also the mammary glands, they start to appear, they start to grow, and that condition in the males you call it as gynecomastia. Okay, so normally they are rudimentary. In case of males, but in the males, if they become enlarged, you call this condition as gynecomastia. Okay, now first of all, if we discuss about the location of the mammary gland, where is the mammary gland located? See, mammary gland, first of all, when you cut down the chest region, the first thing you cut down, the first thing where your scalpel runs is your skin. After the skin, you have got subcutaneous fat. After that, you have got superficial fascia. And after that, you have got deep fascia. Right? So, superficial fascia is the place where your mammary gland is located. And where is your mammary gland located? It lies in the superficial fascia of the pectoral region. Okay? Your mammary gland, it lies in superficial fascia. Of the pectoral region. Superficial fascia of your pectoral region. Now, there was once a question that is asked in your exams, guys, that in the FMG exam. So, what was the question is that mammary gland extends all the way from second rib till the sixth rib. Okay, there was a true or false statement asked, and they told it extends all the way from second rib till fourth rib, which is false. Okay, mammary gland extends all the way from second rib till the fourth rib vertically. Vertically it extends from the second rib till the fourth rib. Okay, so your mammary gland extends from second rib to sixth rib. Okay, second rib to sixth rib vertically. Okay, now for example, if you look at the picture here which I'm drawing, this is your sternum. Okay, this is your sternum, and let us say that this is the body. Okay, this is, let us say, the axillary line. Let us say this is the mid axillary line, and obviously you have got your clavicles like this. Okay, let us say this is your clavicle on both the sides. Now, where is the breast located is that this is the exact place where breast is located. Okay, if you look at the topography, breast lies all the way from the second rib all the way till the sixth rib. Second rib till the sixth rib, and this is what horizontal in nature. Vertically. This is what vertical in nature. Vertically, it lies from second rib till sixth rib. Vertically, the breast ranges all the way from the second rib till the sixth rib, but horizontally it ranges all the way from the lateral border of sternum. See, this pink color thing is the lateral border of sternum. From here all the way till the mid axillary line here. Okay, so what is this called as? This is called as your lateral border of your sternum. All the way till the mid axillary line. So they're gonna ask you two important things, that is vertically it ranges all the way from the second rib till the sixth rib, okay, but horizontally from the lateral border of the sternum till the mid axillary line, horizontally. So this is the exact location in your sternum. This is the exact location in your pectoral region where your breast is located, right? So if you go a little bit down here, right? So as I have already spoke that this is the second rib and this is the sixth rib, okay? And this line which you can see here, this is called as a mid axillary line, and this is called as the lateral border of your sternum. You see this black border is called as the lateral border of sternum. This is the place where your breast is located, right? Now what did I tell you? Breast lies in which fascia? Breast lies in superficial fascia. For a note, let me write it down. The breast lies in the superficial fascia, okay? Second important thing is that if you look at one corner of the breast, I mean if I'm dividing the breast into halves like this, okay, if I'm dividing the breast into 4 quadrants, right, 4 quadrants, now which quadrant does this thing here belongs to? There is a tail-like protrusion, right? There is a tail-like protrusion. Now in which quadrant is this? Can I tell it as superior lateral quadrant? Yeah, in the upper superior lateral quadrant, there is a tail-like projection. What is this tail-like projection? Actually what happens is that, guys, I told you breast is lying in the superficial fascia. That superficial fascia on the superior lateral side, this is the superior lateral side. On the superior lateral side, it will give up a tail-like projection. And this tail-like projection will pierce the superficial fascia. It will even pierce the deep fascia. It will pierce the superficial fascia as well as the deep fascia. What I am exactly trying to tell you is that, let me draw a picture over here. This is the breast over here, right? So the superior lateral region, the superior and the lateral region of the breast, what will happen is that it will pierce the superficial as well as the deep fascia, and it will give out a tail like this, right? So it is what it is doing, it is piercing. You see, it is piercing the deep fascia. So when it is piercing the deep fascia, it will make a foramen, right? It will make a hole and pierce. So that foramen you call it as foramen of Langer. Why am I stressing at this point is that this question has been asked previously in your FMG exam, right? So this is called as this piercing of your deep fascia, this deep fascia foramen, whatever is formed, this is called as foramen of Langer. Foramen of Langer. Very, very, very important. And what is this tail-like projection which is piercing the deep fascia? This tail-like projection is called as axillary tail of Spence. What is this tail-like projection called as? This tail-like projection is called as axillary tail of Spence. Okay, this axillary tail of Spence actually pierces the deep fascia and enters through a foramen called as foramen of Langer. The question which was asked previously was, what pierces or what passes through the foramen of Langer? So what passes through the foramen of Langer? It is the axillary tail of Spence which passes through the foramen of Langer. So this is a very, very important thing. You have to remember it. Okay. Now why this region is very important? Why this superior lateral surface is very important? So let me write all those things in a word format here. So superficial fascia in the superior lateral region, right, it is going to form what? It is going to form axillary tail, right? Axillary tail of Spence. It is called as axillary tail of Spence. Okay. Now this is the region where there is high percentage of breast cancers which happen. So which region of the breast where there are high percentage of breast cancers happen, guys? So this superior lateral region is a place where there is high percent, around 60% of the breast cancers, the breast tumors, they develop from this superior lateral region. Okay. So this is the place where there is highest risk of breast tumors. Highest risk of breast tumors. So this is something that has to be taken to note. Okay, this is very important. Next important thing is that what are the muscles that are in relation with the breast? Okay, if this is the breast, what are the muscles that are in relation with the breast, guys? So if you can very clearly make out a line here, so this muscle, whatever is shown for you here, right? So this entire muscle, whatever is shown for you here, right? So this muscle here, this is called as your pectoralis muscle, isn't it? So can I tell pectoralis major? This muscle name is pectoralis major. And if you see on the lateral side, guys, if you see on the lateral side carefully, you can also find some muscle like this, right? You can also find a muscle here. So what is this muscle on the lateral side of the breast? Inferolateral region of the breast. This is the serratus anterior. What is this muscle? Serratus anterior. Serratus anterior. And down if you see, you can also find another muscle that is showing oblique fibers like this. Oblique fibers upward. So which is the muscle that shows oblique fibers in this way? That is external oblique muscle. External oblique muscle. So if I ask you what are the muscles that are in relation with your breast, then there are three muscles, guys. One is pectoralis major, another one is serratus anterior, next one is external oblique muscle. So these are the three muscles which are in relation with the breast. Next important thing is that, guys, if you look at the breast over here, right, what are the structures that are located here? All of you know that this is the breast, okay, and this portion here, this is called as nipple. This portion here is called as your nipple, okay. And this picture, I think I have drawn it previously when I was explaining you clavipectoral fascia, right? I told you there is scapula. In front of the scapula there is, I told you there is clavicle. In front of the clavicle there is pectoralis major. So please watch that clavipectoral fascia video and come back to this, okay? So this is your clavicle. In front of the clavicle, what is the muscle I have here in front of the clavicle? That is pectoralis major. So it means this muscle over here is my pectoralis major. Next important thing, I told you that below the clavicle, attached to the clavicle only, on the inferior surface of the clavicle, you have got a muscle called as subclavius. Subclavius means sub means below, clavius means clavicle. It is below the clavicle, so subclavius. So this muscle here is called as subclavius. Next important thing is that if I remove this pectoralis major muscle, deep inside I will find pectoralis minor. So this entire muscle here is pectoralis major. Deep inside I am finding this small muscle called as pectoralis minor, okay. And I have already told you that between the subclavius, between the clavicle as well as the pectoralis minor, whatever fascia I have here, this is called as clavipectoral fascia, clavicle pectoralis fascia. So this fascia, which I am highlighting it with the pink, okay, I'll highlight with the pink. So this fascia is called as clavipectoralis fascia. So clavipectoralis fascia, right, on one side it encloses your subclavius muscle, on the other side it encloses your pectoralis minor muscle, okay. Now between and another important thing is that on the surface or covering the pectoralis major, you see a green line that is passing down, covering the pectoralis major, right? So this is the green line, right? This is the green line that is passing down. Now this is covering your pectoralis major, so you call it as pectoral fascia. What did I tell you in the starting? I told you that breast lies in the superficial fascia. If breast is in the superficial fascia, then more inside if you go, there is pectoral fascia. So can I tell pectoral fascia is a deep fascia? Yeah, pectoral fascia is a deep fascia. So between the breast and between the pectoral fascia, you can see an empty gap. I will highlight it. I will highlight this gap with, let us say, some blue color. So you can actually look at some empty gap over here. This blue color thing which I'm drawing here, you can see some empty gap. So this gap is called as retromammary space. What is this blue color gap here called as? This blue color gap here is called as retromammary space. This is called as retromammary space. What is present in the retromammary space? This was a question. That retromammary space has got which type of tissue? Loose areolar tissue. It has got loose areolar tissue. It has got loose areolar tissue, and because of this retromammary space itself, this is the reason why the breast is moving up and down, left and right very freely. Why? Because of this retromammary space. Okay, because of this retromammary space, the breast can move very freely. And next important thing is that I told you that the breast lies all the way between the second rib till the sixth rib, right? Second rib till the sixth rib. And if someone asks you, where does the nipple stay? The nipple, what if you see, look at the nipple exactly lies in the fourth intercostal space. Fourth intercostal space. This is the place where the nipple actually lies. Nipple lies in the fourth intercostal space. Keep this thing in mind. Nipple lies in the fourth intercostal space. Next very important thing I'm going to tell you guys. This is all the time repeated in the exam. Now, before I tell you that, let me draw a small picture. Okay. So here, let us say that here you can draw your clavicle. This is your clavicle. In front of the clavicle, right? If this is your clavicle, okay. In front of the clavicle, I told you that we have got a muscle called as pectoralis major. So this should be what? This muscle should be pectoralis major, right? So this muscle over here is your pectoralis major. Pectoralis major, right? This is clavicle. In front of the clavicle, I have got pectoralis major. And covering the pectoralis major, what fascia I have? What is the deep fascia? That is called as pectoral fascia, right? So this is the pectoral fascia which I am having. What is this called as? This is called as pectoral fascia. Pectoral fascia, that is covering the pectoralis muscle. And in the superficial fascia itself, you have got your breast tissue like this. You have got your breast. This is the breast. And obviously I told you that in front of this, you also have got a blue color line here. This is called as retromammillary space. Behind the mammary gland, you have got retromammillary space. All of you know this thing. Now, one very important thing you need to know is that within the breast, we have got some lobule. Within the breast, we have got some lobes. Okay, within the breast here, we have got some lobes like this. Let us say 1, 2, 3, and 4. Actually, there are 15 to 20 lobes. I'm just drawing 4 of them. There are actually how many lobes? This was a question that was asked. Number of lobes. There are actually 15 to 20 lobes. This was the question. In true or false statement, they have asked this question. 15 to 20 lobes. Now, let us take one lobe here. Now, this lobe comes down all the way and it will open into a sinus. Now, this sinus is called as lactiferous sinus. Okay, what is this sinus called? Lactiferous sinus. Now, from this lactiferous sinus, a duct comes out like this. This is called as lactiferous duct. Okay, what is this called as? Lactiferous duct. So, this is called as lactiferous sinus. Lactiferous sinus. This is the place where the milk is stored, right, during lactation, and this is called as lactiferous duct. Lactiferous duct. Okay, so how many lobes are there? 15 to 20 lobes. Now, how many lactiferous ducts are there? The same 15 to 20 ducts. Okay, so both of them were the questions previously that were asked. Okay, next important thing is that regarding the areola. So next important question is regarding the areola. What is areola, guys? All of you know what is nipple. Surrounding the nipple, you have got a hyperpigmented area, and that is called as areola. So pigmented circular layer on the skin. Okay, so what is areola? Areola is nothing but it is a pigmented circular area of the skin. Pigmented circular area of the skin is called as areola. So look at this. See, this part is called as your nipple, and surrounding the nipple, whatever is there, this is called as your areola. Now, why am I teaching you this important thing here? The reason is that surrounding the nipple, you have got some small, tiny protrusions outside the skin, right? So these small protrusions, whatever you can see, These small protrusions are actually called as sebaceous glands. Sebaceous glands which secrete sweat, right? Next important thing is that during pregnancy, right? During pregnancy, what will happen is that these sebaceous glands, they become more prominent, they become more enlarged. You can see in the picture before and after pregnancy. Before pregnancy and during pregnancy. During pregnancy, you can see these glands that are enlarged, right? So now these glands which are enlarged, they are enlarged during pregnancy. These are enlarged during pregnancy, and these glands are now like tubercles. So these are called as tubercles of Montgomery. These are called as tubercles of Montgomery. Tubercles of Montgomery. This is a very, very important thing. Okay. Next important thing all of you have to know, that the nipple as well as the areola, nipple and the areola, they don't have any kind of hair or fat. They are devoid of hair and fat. They are devoid of hair and fat. Next important thing you need to know is that, look here, look in this picture, that you see some small lines passing in this way, right? So you see these lines here. What are these green color lines? These green color lines, what they are doing is that they are actually attached to the surface of the skin, right? So green color line is starting, let us say it is starting. What are these green color? Repeat. What are these green color lines? These green color lines are nothing but, these green color lines are the connective tissue, right? So within the breast tissue, you have got a connective tissue. Now the connective tissue will undergo condensation and it will form some septae. These are those septae. So what am I telling you is that within the breast parenchyme, within the parenchyme of the breast, within the tissue of the breast, we have got connective tissue. And this connective tissue will undergo condensation and form strands or septa. Strands or septa, right? So what are these strands or septa doing? What are they doing is that they are one side attached to the parenchyma, and on the other side the string is attached to the surface of the skin. One side they are attached to the parenchyma and they are attached to the surface of the skin on the other side. Let us say, see, one side they are attached to the parenchyma and one side they are attached to the surface of the skin. Here also one side they are attached to the parenchyma, here they are attached to the surface of the skin. Okay, why these things are important? Because the first thing is because of its name, that these are called as ligaments of Cooper. These are called as ligament of Cooper. Okay, fine. This is called ligament of Cooper. Fine. Then what happens? The next important thing you want to tell? The next important thing is that whenever a breast tumor develops, right, the tumor cells, they start infiltrating. They enter into this ligament of Cooper. Okay, they enter into this ligament of Cooper. Once when these tumor cells, they enter into this ligament of Cooper, what ligament of Cooper will do is that ligament of Cooper will contract like this. It will pull like this. So in the one side ligament is attached to parenchyma, but on the other side it is attached to what? It is attached to the skin. So what it is doing within this pipes or within this ligament, there is a lot of fibrous tissue that is deposited. There is a lot of cancer cells that are deposited. The ligament undergoes contraction. Then the ligament will shrink when it undergoes contraction. On the other side, as it is attached to the skin is pulled inside. This is called as retraction of the breast, right? The entire skin of the breast is retracted inside. I will show you that picture. How does the retraction look? At the end, I will show you that picture. But just keep it in mind that right now, this is called as a ligament of Cooper. One side it is attached to the parenchyme. Let us make a note. So it attaches parenchyme to the skin. Parenchyme to the skin. Next important thing is regarding the arterial supply. Okay, now what is the important thing regarding the arterial supply? Now what supplies the breast? All of you know that coming out of your heart, all of you know subclavian artery, right? Subclavian, okay, let me just write a small thing over here, right? So this is the subclavian artery, for example. Okay, I'm not drawing all the way from the heart, but just think that this is, okay, let me draw it from the heart itself so that you would understand better. Okay, let us say this is your heart. Okay, all the way there is a vessel that is coming out of your heart. This is called as your aorta, all of you know, right? Now aorta gives branches on the right as well as on the left. We are not concerned about the left side, we are concerned about the right side. Okay, we have a trunk that is coming, that is called as brachiocephalic trunk. Now this brachiocephalic trunk will divide into two branches. One branch comes onto the right side, this is called as right subclavian artery. Another branch that goes up, this is called as common carotid artery. This is called as common carotid artery, right common carotid artery. This is called as right subclavian artery. Okay. Now all of you know one very important thing, that right subclavian, this is right subclavian artery. Now right subclavian artery, further it continues as axillary artery. Let us say till here it is axillary artery. Axillary artery continues further as brachial artery. This is brachial artery. And all of you know that brachial artery will divide into two branches. One which is going on to the radial side. So here is the subclavian artery. Subclavian artery coming down all the way, it will stop here. From here axillary artery starts. Axillary artery stops in the middle somewhere here. And then the brachial artery starts. Brachial artery enters into this cubital fossa and divides into two branches. One which goes onto the right side is called, one which goes onto the right side is called as radial, which goes onto the left side is called as ulnar. So all of you know that this is right subclavian and this is axillary artery, right? Now the same thing I'm going to put it over here. Let us say this is a branch. Okay, fine. So let me draw, this is your clavicle, for example. Okay, now there is an artery that is coming all the way, right? So this is your subclavian artery. Now your subclavian artery will continue forward as till here. From here it continues as axillary artery and it passes down like this. Okay, now from your subclavian artery there is one branch that enters inside the thoracic cavity. So you call it as internal thoracic artery because it is entering inside the thoracic cavity. So from the subclavian artery you have got a branch that enters inside the thoracic cavity like this. This is called as internal thoracic artery. The first artery is internal thoracic artery. So the other name which you give for this internal thoracic artery is internal mammary artery. You can also give it as internal mammary artery. Okay, now this internal mammary artery will give out few branches that supply to the breast in this way. Now these branches which are given by this internal thoracic artery or the mammary artery, these are called as perforating branches. So this would give what? Perforating branches. Perforating branches. Just remember that it gives perforating branches to the second, third and fourth intercostal space. Third, fourth. Why second, third, fourth, sir? Because I told you that breast lies all the way from second till sixth. So it gives its contribution is to second, third as well as the fourth intercostal space. Next, we are done with the subclavian artery. Now come to the axillary artery. Axillary artery. So this is a branch of subclavian artery. Subclavian artery, right? Now let us discuss the branches of axillary artery. Axillary artery gives out three thoracic branches. Three thoracic branches. Now look here. I am drawing it with green. Okay. So one thoracic artery comes from the top here. This is called superior thoracic artery because it is coming from the top. Another thoracic artery is coming like this. This is called as acromiothoracic artery. Okay. And there is one more thoracic artery that comes and supplies to your lateral surface of the breast like this. This is called lateral thoracic artery. So what are the three thoracic arteries? What are the three thoracic arteries? One is called as superior thoracic artery. Another one is called as acromiothoracic artery. And the third one is called as the lateral thoracic artery. Thoracoacromial artery or acromiothoracic artery. This is both of the same. So these are the three axillary artery branches. And the last one you need to know is that there are some more perforating branches. Okay. So there are some more let us say there are some more perforating branches which are perforating and coming inside and supplying like this. Okay, there are some more perforating branches like this. So these perforating branches are of posterior intercostal artery. These are of posterior intercostal artery. So let us write it down as 1, 2, 3. So this is 1, this is 2, and this is 3. And these are posterior intercostal artery perforating branches. Posterior intercostal artery. So this arterial supply, guys, if you really understood, then no question will miss, because whenever they ask about this, definitely they will ask you about arterial supply. And personally I have seen that many number of questions have been asked from this arterial supply. This is very, 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 very important. Okay, now, so overall, what are the branches, guys? The first important thing is, the first important branch is internal thoracic artery or internal mammary artery. Okay, second branch is the superior thoracic artery, acromiothoracic and lateral thoracic, and the last branch is the posterior intercostal arteries. Okay, now one clinical important thing which you need to know is that this internal thoracic artery is on the right side, right? So there is also an internal thoracic artery on the left side. Obviously, it will be on the left side also. That is called as left internal mammary artery or left internal thoracic artery. So left internal thoracic artery is the artery which we use basically for 𝐒𝐫𝐞, coronary artery bypass graft. Okay, you also use saphenous vein, that is a secondary thing, but most importance you give to the left mammary artery. Okay, so keep this thing in mind, that the left internal thoracic artery or the left internal mammary artery is used for coronary artery bypass grafting, 𝐒𝐫𝐞, coronary artery bypass. So guys, now we shall be discussing regarding the lymphatic drainage of the breast. Okay, so we shall be focusing on the lymphatic drainage. Now, when it comes to the lymphatic drainage, what are the important things you have to know? First of all, you have to know where are the lymph nodes located and what are the names of the lymph nodes. Okay, so once I will explain you those things, then I will tell you how the lymph is getting drained and which portion receives the maximum lymph, or I'll also tell you where does the cancer happens most commonly, and everything we shall be discussing right now. Okay, so first very important thing is that you have got a group of lymph nodes exactly here. These group of lymph nodes are called as anterior lymph nodes. When I tell anterior, back of it will be posterior. Where is the back of that? See, this is the back of that, right? So back of this will be the posterior lymph nodes. So there is anterior lymph nodes, there is posterior lymph nodes. Then there should be lateral also, right? So where are the lateral lymph nodes? Lateral lymph nodes will be away from the body, isn't it? So let us say that here we have got the lateral lymph nodes like this. These are the lateral lymph nodes. What are they? They are the lateral lymph nodes. Okay. Next important thing is that there is anterior, there is posterior, there is lateral. So all of them together, if you look here, all of them together, they are in this way, isn't it? And what is this portion should be called as? This portion should be called as apex. So apex has got group of lymph nodes called as apical lymph nodes, or I can also call it as central lymph nodes, right? So here I have got a group of lymph nodes. Let me draw a little bit up. Group of lymph nodes. These are called as central lymph nodes. What are these called? These are called as central lymph nodes. Okay. And next important thing is that here completely on the top, I have got a group of lymph nodes. These are called as apical group of lymph nodes. What are they? They are called as apical group of lymph nodes. So what we have discussed, guys? We have discussed that there is anterior group of lymph node, there is posterior group of lymph node, there is lateral group of lymph nodes, right? And we have got a central because it is exactly in the center, and then which is on the apex is called as the apical group of lymph nodes. Clear? Now all these lymph nodes which I have just mentioned, all of them are located in the axillary region. So all these lymph nodes are called as axillary lymph nodes. All of them are called as axillary lymph nodes. Okay. Next important thing is that inside the mammary gland over here, right? Inside the mammary gland over here, we have got a group of lymph nodes like this on either side. On either side, these are called as internal mammary lymph nodes or internal mammary nodes. So these group of lymph nodes here, these are called as internal mammary node. Okay, what are they? These are called as internal mammary nodes. Next, above the clavicle, we have got lymph nodes. Below the clavicle also we have got lymph nodes. So above the clavicle is called as supraclavicular. Below the clavicle is called as infraclavicular. So this is supraclavicular and the down one is infraclavicular. Okay. So we have also got supraclavicular and infraclavicular. Supraclavicular and infraclavicular. Next important thing is that in the deltoid region here, also we have got lymph nodes, guys. Okay, even in the deltoid region here also we have got a lymph node. This is called as deltoid lymph node, or what is this lymph node? It is also called as deltoid or cephalic lymph node. What is this called as? This is called as deltoid or cephalic lymph node. And finally, we have just left over with the three groups of lymph nodes. What are these three groups of lymph nodes are? There are some lymph nodes which are located here on the back region, right? On the back region here. These are called as posterior intercostal lymph nodes. What are these lymph nodes called? These are called as posterior intercostal lymph nodes. Posterior intercostal lymph nodes. And finally, we have got two lymph nodes. They are located below the diaphragm. They are called as subdiaphragmatic lymph nodes. So what are they called? They are called as subdiaphragmatic. So here we have got lymph nodes like this. These lymph nodes are called as subdiaphragmatic lymph nodes. And there are also another group of lymph nodes. These are called as subperitoneal group of lymph nodes. So what are these two? One is called as subdiaphragmatic lymph nodes. Next we have got subperitoneal lymph nodes. So how many? 7 groups of lymph nodes we have got, guys. So this is the first group. Next we have got the second, third, fourth, fifth, sixth as well as seventh. So let us look at what are these lymph nodes. Axillary lymph nodes. Axillary lymph nodes are anterior, posterior, lateral, central, apical. Next, internal mammillary lymph nodes we have got lymph nodes above and below the clavicle, supra and infraclavicular, right? And one lymph node we have got in the deltoid region, that is called deltoid or cephalic. Next, we have got the posterior intercostal, subdiaphragmatic and subperitoneal lymph nodes. So these are the list of lymph nodes which we basically have. Okay, so I don't think so it is really difficult to remember. It is very easy to remember here. And one more important thing I want to tell you here is that, guys, that let me write it here itself, that actually lymphatics are of two types. Actually, lymphatics are of two different types. So superficial lymphatics as well as deep lymphatics. Some are called as superficial as well as deep lymph vessels. Superficial lymph vessels as well as deep lymph vessels. So what are these superficial and deep? If you look at the breast, okay, the entire skin of the breast, see guys, this is the breast, okay, this is the breast. In the center we have got the nipple. Surrounding the nipple, the dark pigmented portion, this is called as what? Areola. That is called as areola. So the skin of the breast completely, right, is drained by these superficial lymph vessels. So superficial lymph vessels, what do they drain? They drain everything that is present in the skin region of the breast. Okay, so that is very important. So superficial, why? Because I'll tell you later on a clinical condition there. So superficial in the sense they drain the skin of breast. Then what about the nipple and areola? They don't drain the nipple and areola. They don't drain the nipple and areola. Then who is draining the nipple and areola? The nipple, the areola. Not only that, the skin, again the skin of the breast. And if you if you look at the breast, right, inside you have got a lot of parenchyma. So even the parenchyma, all of them are drained by the deep vessels. So we have got two groups of lymphatics, superficial as well as deep lymphatics. Superficial, only skin. Deep, the nipple, the areola, the skin and parenchyma. So it drains all of these structures. The deep lymphatics will drain the nipple, the areola, the skin as well as the parenchyma. So this is very important to know, because later on I will tell you that if there is obstruction of superficial lymphatics, if the superficial lymph nodes or the lymph vessels, if they obstruct because of a tumor or something, then skin cannot be drained, right? The fluid, whatever is there in the skin, it cannot be drained into the superficial vessels. So the fluid will stay within the skin region, and what will happen? The breast will swell up. So this condition, I'll tell you what is that at the end. I'll tell you, but just keep this thing in your mind. Next important thing, there was a question that is asked, guys. So this is a breast, right? And all of you know what is this thing? This is called as the axillary tail of Spence. All of you know this. So what I'm telling you is that in the center here, you have got your nipple. Surrounding the nipple, what is that area? Yes, surrounding the nipple, what is this area here? This is called as areola, right? So within the areola here, I have got some kind of plexus. Now what is this plexus within the areola? In the areola, I have got a plexus, and this plexus is called as subareolar plexus. Subareolar plexus of Sappi. This is called as subareolar plexus of Sappi. Subareolar plexus of Sappi. Okay, you look here, guys. If you look at the picture, this subareolar plexus of Sappi is draining into some lymph vessels here. And these lymph vessels, they are going all the way up and finally draining into a group of lymph nodes. And what are these lymph nodes? They are called as axillary lymph nodes. Axillary lymph nodes. Okay, so finally, where are they draining? They are draining into axillary lymph nodes. Where are they draining? They are draining into axillary lymph nodes. So this was a question that was previously asked, that which the subareolar plexus or the plexus of Sappi drain into which group of lymph nodes? That is axillary group of lymph nodes. Axillary group means we discussed, right? Anterior, posterior, lateral, central, apical, all of these are axillary group of lymph nodes. Okay. If you look at this picture, guys, all of you know what are these groups of lymph nodes here, right? So what will be this group of lymph node, guys? Yes, this is called as anterior. I'm not writing it. Okay, let me just I'm just marking it with a single letter. This is called as anterior, and this is called as a posterior. This is called as, let us say, lateral. This is called as central. This is called as apical. This is called as deltoid. This is called as supraclavicular. There is no infraclavicular here. And this is called as internal mammillary, right? Internal mammary lymph nodes. Okay, and these are called as posterior group of lymph nodes. Now, having said this thing, let me rub this out. Important thing is that how the lymph is draining. So if you wanted to know how the lymph is draining, look here, this is the breast. Okay, now the breast is divided into four different quadrants. In the center, what do I have? I've got the nipple. Four different quadrants. What are these four different quadrants? Upper two quadrants are called as superior quadrants. Lower two quadrants are called as inferior quadrants. So upper two are called as superior. So one is called as superior medial. One is called as superior lateral, which has got the tail of Spence. Next we have got the inferior medial. Next we have got the inferior lateral. Okay. Now remember one thing. I'm drawing that same thing over here. Look here. I'm just putting up the line here, but I'm not writing superior medial, superior lateral and all. Okay. Now, one very important thing you need to understand is that the superior lateral as well as the inferior lateral, you can also, if you want, you can call it as lower lateral. The upper one you can call it as upper lateral. Okay, lower lateral, upper lateral, whatever it is, superior lateral, inferior lateral, whatever it is. So the superior lateral as well as inferior lateral lymph nodes, you know, where do they drain? All of them, look here, superior lateral, inferior lateral, these they drain into the axillary group of lymph nodes. They first drain into the axillary group of lymph nodes. For example, they drain into anterior, they drain into posterior. So once they have drained into anterior and posterior group of lymph nodes, now what will happen? Now the anterior will drain into central, the posterior will also drain into central. Okay, so the superior quadrant, inferior quadrant on the right side, on the lateral side, superior lateral and inferior lateral, first they drain into anterior posterior group of lymph nodes. These both together they drain into central group of lymph nodes. And from there, they drain into the deltoid lymph node, right? From there, they drain into the apical lymph node. From there, they drain into the supraclavicular lymph node. So then what about this lateral lymph node? The lateral lymph node also drains into the central lymph node. That is why it is called central, because all the lymph nodes are draining into that central lymph node. So you call it as a central, the main lymph nodes. Okay, the main lymph nodes. Occasionally, only occasionally, sometimes that too this inferior lower quadrant, whatever is there, occasionally sometimes it will drain into the posterior group of lymph nodes, right? So these are called posterior, I have already told you. So these are called as posterior, intercostal lymph nodes. Posterior intercostal lymph nodes. I told you this long back only, right? So what I'm telling you is that occasionally the inferior lower quadrant or the lower lateral quadrant, right? Inferior lower or lower lateral, whatever it is there. So that quadrant drains, few of its vessels will drain into the posterior intercostal lymph nodes. But majority of, right, the upper as well as the lower lateral side, right? So majority of this entire lateral group of the breast, whatever is the lateral side of the breast, majority is draining into which side? The axillary group of lymph nodes. You know how much it will drain? Around 75% is drained into axillary lymph nodes. So that is the reason why, if in this area, the superior lateral and inferior lateral, this lateral part of the breast, if there is any tumor, the tumor will very easily enter into the axillary lymph nodes. And that is the reason why axillary lymph nodes are under high risk of getting an attack by these tumor cells. Okay, getting an attack by these tumor cells. Now then what about the medial part? Medial part, in the sense we have got superior medial, we have got inferior medial, or upper medial or lower medial. Okay, superior medial or inferior medial. Now these superior medial and inferior medial, both of them, they drain into the internal mammary lymph nodes. It means they drain into these internal mammary lymph nodes like this. They drain into the internal mammary lymph nodes. Now you can ask a doubt, sir, but if there is a cancer on one side of the breast, can it spread to the other side? Yes, it can very easily spread. You know how? How, in the sense, there are also internal mammary lymph nodes on other side also. There are also internal mammary lymph nodes on other side also. And this superior medial and inferior medial, they not only drain into the internal mammary lymph nodes on the right, sometimes they also drain into the internal mammary on the left. So if there is a cancer here, if there is any kind of tumor here, the tumor can easily spread onto the left side, isn't it? Right? So I hope you understood. So majority of the lymph drainage on the lateral side is into the axillary lymph nodes. Majority of the lymph drainage on the left, on the medial side, is onto the internal mammary lymph nodes. Occasionally on the lateral side, the lymph vessels, they even drain into posterior intercostal. But when it comes to medial, occasionally on the medial side, the lymph vessels, they even drain down like this. Where do they drain? Here you have got a plexus. You know what is that plexus? That is present below the peritoneum. So you call it as subperitoneal plexus, subperitoneal lymph plexus, lymph plexus. So occasionally the inferior and the medial quadrant, right? Inferior medial quadrant, occasionally it will drain into the subperitoneal lymph plexus. Okay, then why did you tell this point? Is it really important? Yes, it is very, very important. You know why? If you come down a little bit, right? So this is, let us say, this is the uterus all the way down here. Okay, now this is the place where you have got your ovary. You have got your ovary, right? Now, sometimes what will happen is that the tumor cells, if there is any kind of tumor in the, let us say, the subperitoneal plexus, right? This subperitoneal plexus will directly drain onto the ovary. It will directly supply the ovary, it will directly drain into the ovary. So even the tumor cells can come all the way like this and they can very easily land on the ovary. So once if this kind of tumor cells movement all the way coming from the subperitoneal lymph plexus onto the ovary, this kind of tumor, you call it as a Krukenberg tumor. You call it as a Krukenberg's tumor. Krukenberg's tumor. Right? So I hope you understood whatever I've taught you. So simple way, don't remember all of these things individually because it is really hectic. Simple way, guys. Breast is divided into 4 quadrants. Okay. We have got the right 2, left side 2. Right side 2 are called as a lateral. Left side 2 are called as a medial. Most of the lateral will drain into axillary group of lymph nodes. But only a little part. For example, inferior lateral will drain into posterior intercostal. The same way applies onto the left also. Most of the medial quadrant will drain into internal mammary lymph nodes. But a little part of that, like what is that? Inferior medial quadrant will drain into the subperitoneal lymph plexus. And from there, it drains overall into the ovary. So, as this draining is happening, this type of draining from subperitoneal lymph plexus to the ovary is called as intracoelomic. It crosses the coelom and then it enters inside. And it causes tumor. If there is a tumor there, it will pass down onto the ovary called as Krukenberg tumor. Right? So, what I am trying to tell you is that 75% of lymph, that lymph drains into, 75% of the lymph drains into the axillary lymph nodes. Okay. Next, 20% of lymph drains into internal mammary nodes. Internal mammary lymph nodes. 20%. But whereas 5% of lymph drains into the posterior intercostal. Lymph nodes. 5% will drain into posterior intercostal lymph nodes. Right? So if I tell you there is a patient with breast carcinoma, breast cancer, right? Breast carcinoma. So mostly which quadrant can affect, guys? In 60% of the cases, the upper left quadrant. Repeat. In 60% of the cases, the upper lateral quadrant. The upper lateral quadrant can affect it. In 60% of the cases, the upper lateral quadrant can affect it. Okay? Okay. For example, if a patient is having, let us say, breast tumor, right? If patient is having breast carcinoma. So clinically, how will the patient present to me? Yes. Clinically, what will be the signs? The first important thing is that when you touch on the breast here on the upper lateral side, you will find a hard lump and patient complains of no pain. So you will find a painless hard lump. Apart from that, because of a lot of fibrous tissue and a lot of cancerous cells that are deposited in the breast, I told you because of the retromammillary space, the breast can move freely. Now, because of a lot of tissue that is deposited there, the fibrous tissue, the breast becomes strong, the breast becomes stiff, right? You cannot move the breast easily. So the breast becomes fixed and immobilized. Fixed and immobilized. Third important thing is that I already told you that if this is the nipple here, this is the breast, this is the nipple as well as this is the breast. Let us say this is pectoralis major muscle, and I told you that to the skin of the breast, to the skin of the breast, there is a ligament that is attached to the skin of the breast like this. What is this ligament? This is called as ligament of Cooper. Now, if there is a lot of fibrous tissue, if there is a lot of cancerous cells that are deposited on this ligament of Cooper, then this ligament of Cooper will shrink. It will stretch inside. So, when this ligament of Cooper is shrinked, what will happen when it will shrink? What will happen is that the entire skin of the breast will fold inwards. Okay. So, this is called as retraction. This is called as retraction. Okay. This is called as breast retraction. Fourth important thing is that it can also happen like this, that let us say, I'll show it to you in this picture itself. Let us say that this duct here, this is called as lactiferous duct, and here you have got lactiferous sinus, and from here you have got what? This is called as a breast lobe. For example, if there is a lot of fibrous tissue that has been deposited in this lactiferous duct, how many lactiferous ducts are there? 15 to 20. So if this a lot of fibrous tissue or the cancerous cells are deposited in these lactiferous ducts, all these lactiferous ducts also are pulled inwards, right? They are shrinked inwards. They completely undergo shrinkage. So in that case, what will happen? This nipple, whatever is there, even nipple is attached to lactiferous ducts, so nipple also will undergo shrinkage inside. So nipple will go inside the mammary gland. Right? This is called as inversion of nipple or inverted nipple. So this is called as inverted nipple or nipple retraction. Inverted nipple or nipple retraction. So let me show it to you. Where is this nipple retraction? Right? You can very clearly look at these two pictures over here. So these two pictures will depict the nipple retraction. You can see very clearly how the nipple has been retracted inside. Okay. So next important thing that I told you here, one very important thing previously I told you that lymphatics are of two types. One is called as a superficial group of superficial lymph vessels and deep lymph vessels. Superficial lymph vessels, they drain what? They drain the entire skin of the breast. Okay, they drain the entire skin of the breast. So let us say this is the breast over here, this is the nipple, and this is the breast like this, right? And let us say that this is pectoralis major muscle. So superficial vessels, what do? Is that they drain only the skin of breast. They do not drain the nipple. They do not drain the areola surrounding it. They only drain the skin of the breast. So let us say diagrammatically that they are draining only the skin like this. Okay, they are draining only the skin in this way. Okay. For example, because of this cancerous cells, there is a blockage of these lymphatic vessels. Mainly what? The superficial lymph vessels. If there is a blockage, do you think the fluid can drain into these lymph vessels? It cannot drain. So when it cannot drain, the fluid starts depositing within the breast tissue like this. So when the fluid starts depositing within the breast tissue undergoes swelling. There is edema of the breast tissue. So if you look, the breast tissue is so swollen that it looks like an orange. So that condition you call it as PUD orange syndrome. If you look at the picture, you'll understand that this is a normal orange. Okay, and look at the PUD orange. Look at this picture, guys. This is a normal orange, and look at this breast here. Is there any similarity? Almost both of them are looking same. It is looking like an orange, right? So this is called as PUD orange. because there is excess amount of lymph that is deposited within the breast tissue. This is called as PUD orange. And previously guys, there was also one more question that was asked in the exams, that which nerve supplies your breast. So remember one thing, the entire breast is supplied by 4th to 6th intercostal nerve. 4th to 6th intercostal nerve. But whereas your nipple is supplied by the 4th intercostal nerve. Your nipple is supplied by 4th intercostal nerve, and the remaining every part of your breast is supplied by 4th to 6th intercostal nerve. This is very important, that has been asked previously in the exams. Okay.